perspectives on trauma, sharing our views and healing our world.
With me today is Katherine Mague, Senior Vice President at Behavioral Health Network. Welcome, Kathy.
Thank you. Good to be here.
Thank you. I guess to begin, could you talk a little bit about how communities can work to heal trauma, whether individually or collectively?
Yes. So the community is a really, really important part of the puzzle when we think about trauma and how it affects individuals and then how that is perpetuated over time and over generations. So I guess my lens on trauma comes from a clinical background, if you will. I'm a clinical psychologist by training, and I work at the Behavioral Health Network where we do clinical treatment for trauma. The lens that I bring to it is that of a biopsychosocial framework of sort of the genesis of trauma. What I have found very interesting over the years is that there are degrees of which our experiences affect us relative to our traumatic response, if you will. Mm-hmm. So there are objectively traumatizing experiences that can be defined by things like, have you lost control of a situation? Was it sudden and unexpected? There's a lot of different factors that can define what makes an experience traumatizing objectively. But then whether experiencing that traumatic experience develops with psychological trauma for an individual depends on a number of different factors. So if it's a single event versus repeat events, so single events have less likely to result in psychological trauma for the person experiencing it. Mm-hmm. Chronic repeated events are more likely to result in a traumatic response. Mm-hmm. How close you are to the situation also has an impact, obviously. People who've experienced shootings, for example, or abuse, if it's the person that was the abuser or the perpetrator was known to the person who experienced that event, that's going to be much more impactful to that person's emotional well-being, if you will. The other factor that affects, and this is where I get back to community, mm-hmm. the other factor that affects how somebody experiences a potentially traumatizing event is the protective factors that they have themselves. So people with lots of resilience and protective factors can withstand more exposure to a potentially traumatizing experience than people who have fewer of those resources, protective factors. And the last piece of this puzzle is that as we are herd creatures by nature, mm-hmm. we're animals, we're herd creatures, and when we experience something scary or distressing, we seek comfort in connection with others. Mm-hmm. And so I think the role of community is a protective role for us, mm-hmm. and should play that role. I think related to that is, I think last summer the Surgeon General came out with 2 new really informative advisories. One, that social isolation mm-hmm. has as much negative impact on our emotional well-being as smoking, on our overall health, mm-hmm. as smoking and obesity, mm-hmm. isolation. And so again, if you are feeling in a situation that you are isolated and not connected in community, you're not going to be as resilient to potentially traumatizing experiences. Mm. So it was a really long-winded answer to your question.
So I guess looking at, from, administrative and programmatic, yeah. How are these things cultivated in a community? These healing connections within the community.
Right. Great question. So I guess a couple of things. I think recognizing, I guess a couple of thoughts about how what's taking away from that, I think helps inform what we do instead. As powerful and impactful as social media and devices like cellular phones are for good, there's a lot of good that brings in terms of, for example, people who feel isolated can find maybe more connection on the World Wide Web than they do in their own community, particularly for some marginalized communities. I think the challenge is that it often takes us away from the present moment and from ourselves and each other as we go into this world that is removed. And so I think a really, really important thing that communities can do to build resilience, and that networks and systems and structures like municipalities, school districts, community centers, elected officials, that they can do, is to reinforce the importance of real, live, in-person, real-time connections. Put down, like I say all the time, put down the phone. And reinforce also, I guess another factor in this is focusing on parents and young children is really important in creating protective factors that prevent trauma at a systemic level, because a parent's ability to stay engaged and regulated themselves and then to connect with their child in ways that foster resilience, emotional regulation, connection in their children will grow the neural pathways that help you be resilient. So when you experience trauma, it actually changes your brain, neurochemically changes your brain. And from birth to 3 is a really important time for children to build healthy, resilient coping pathways in their brain. So I guess to loop back to your question, what at a systems level we can do is encourage time off of screen, set expectations, set boundaries, create opportunities for engagement with each other in the real present time. And also create and promote opportunities for parents to connect and manage their stress, and for parents and children to engage in healthy activities together.
You speak about the devices and possibly how they are used for immediate response, immediate gratification. So this is kind of balancing that with something maybe a little bit more prolonged, or sounds like more patience involved with the alternative to that.
Right. So another little bit about sort of the biopsychosocial theories of trauma is that basically we are hardwired to our physiology responds when we believe that we are facing a threat to our survival. That's where it comes from, like way back in the day, right? That we believe that the tiger's about to eat us, and so our physiology responds in a very basic, primitive way to keep us protected. And that response creates a certain secretions of certain hormones and brain chemicals that tell our body to increase blood flow so that we can fight or flee, to slow down our ability to think adaptively. So we're not thinking problem solving and planning. We're not thinking logically. We're just thinking, get away from this threat. So when we experience the challenge in our current day and age is that we misinterpret experiences. Any stress response is a minor version of the trauma response. And so we misinterpret cues as some existential threat to our survival, and that trauma response gets triggered. So I'm telling you all this in the context of the phones is because the fight or flight response and what they call rest and digest are two sides of the same biopsychosocial coin, if you will. And they can't operate at the same time. So one of the antidotes to a sort of traumatic trigger or traumatic response is to slow your nervous system down. So if you're slowing your nervous system down, you are coping better with that and sort of deactivating your fight or flight response. One of the other problems, as you point out, with phones is that it further escalates and elevates our arousal level. Our physiological, chemical arousal level is elevated by this constant scrolling that it engenders in us, and by this immediate gratification life that we live now, that there is not opportunity for people to practice. And when you practice that waiting, you practice the patience, you practice the frustration tolerance, you practice all of those things. It's almost like if your baseline of arousal is here and you experience a potential trigger, a traumatic trigger, you elevate much higher, much faster. When you take time and opportunity to lower that arousal level by putting away the phone, by engaging in things that trigger the rest and digest response, yoga, meditation, a walk in nature, any of those things will lower your baseline so that if you experience something distressing, you're less likely to go to that place of a trauma response.
So maybe perceived exclusion from the group.
Yep.
Okay.
Yep. Right, exactly. So if you're up here all the time because you don't ever take that break, that sensory break from the constant of the phone or the media, you never take that break, something like exclusion from the group could make you feel at a very primitive biologic level that you are experiencing a threat to your survival. It doesn't sound logical when you think about it. Like, I've been on my phone all day and now my friend disses me. I'm not going to die. I know I'm not going to die. But your neurobiology misinterprets that and sends chemical signals that we don't logically understand, but do actually trigger your biopsychosocial traumatic response.
So it sounds with this biopsychosocial, social might be where is social at? Because I'm thinking about different populations that even reside in Massachusetts and their past experiences and adapting to a new society. So could you speak a little bit about how past experiences that are shared and maybe true actual traumas in their lives, and they're in a place where that isn't present. So how do you navigate that?
Right. I guess a couple of thoughts about that. One is trauma, like I mentioned, does change your neural pathways. And it is more significant when you experience chronic, prolonged trauma as a young child without the kind of resilient and protective factors that help you regulate in the face of that. So if, for example, you came from another place where you experienced war, community violence, any traumatic experience, prolonged, close, violent, connected to you, if you had protective people in your life, family members who could help you make sense of that experience, who could help you feel safe in spite of being exposed to those factors, then your risk of sort of developing, of your brain changing as dramatically is lessened, if that makes sense. So you would come to this current situation with less, more healthy, less changed and less maladaptive, I guess, brain structure is one piece. I guess another piece is that the lens through which you see your situation is informed by the past. So it is not uncommon for people, for example, if you have experienced, if the place that you came from before, there was gunshots frequently, for example, if you were growing up in a war-torn country, and you come to a place where it doesn't have that, but you hear a loud car backfire. It's, again, a biologic response, an adaptive biologic response to react in the same way to that car backfiring. And suddenly you're back and your body has that same response. So it takes a rewiring of your nervous system to, and repeat exposure to a new environment with a lot of support to change that. So I think you can come, from example, from a war-torn country to a peaceful place and change how you experience it. It will take usually support from a community and repeated experiences where your body learns. When I work with kids, I often talk with kids about that the trauma response is like your body's fire alarm system, and it starts in the limbic system back here, your sort of very primitive brain. And when you get a trigger like a car backfire, this part of your body that's designed to protect you will turn on, and it turns off your thinking brain. And it sort of goes beep, 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 like fire alarm, right? Risk, danger, shuts down all of everything else. And what you need to do is have supports around you who can help you see that, wait a minute, the fire alarm went off, that was a false alarm. I don't need to respond that way anymore. When that was a gunshot, that was helpful. That taught me how to keep myself safe. Here in Massachusetts, that car backfiring does not require the same fire. I don't need the fire trucks to come. And so over time, you can teach yourself, you get that fire alarm goes off, you take deep breaths, you remind yourself that there's no risk, I'm not at risk, I'm okay. You settle your nervous system back down, and then over time you can retrain your body and your brain.
So when you work with people in maybe resetting these pathways, do you find that a family unit with shared trauma can reset better together, or is it better to be done individually?
I would say there's a role for both. I think if the family has support and they're working on it, I guess, together and equally committed to it, then I think it can be very healing for folks to go through that together, because they can sympathize, empathize, and connect around their shared experience, and they can cue each other and coach each other. Like, it's very validating to have somebody say, that was really hard, right? What you just went through was very hard. And I have a side note on that, but I'm going to come back to it. If there are some family members that are farther along in the process than others, it may be more important to do that healing separately, because I can imagine a situation where there might be a parent who's struggling more, and they don't have the same coping skills that maybe a child is developing with a therapist or a school counselor. And the parent's more exaggerated response would sort of set the kid back, if that makes sense.
You spoke a little bit about possibly the healing or the calming effects of nature.
Yes.
So I guess from your background, can you speak to the specific things? What being in nature actually do to the human body and the human brain when it comes to recovering from these experiences?
Yes, it's one of my favorite topics. Yes, I am a self-professed nature lover. And it really hit me at one point. I read a study that was published in a well-respected journal of medicine, that they did a research study on children recovering from surgery in hospital. And they had 3 groups of kids. And one group, it was a medical procedure, but going through surgery is traumatizing, or potentially a traumatic experience. And especially if you're a child and you're cooped up in the hospital, that's an objective, potentially traumatizing experience that they would need to recover from. One group looked out their window and saw a parking lot with concrete. One group had paintings of trees and photographs of trees on the hospital wall, and they looked out the window at the parking lot. And the third group looked out the window at a park that had trees and grass and birds and flowers and such. And the rate of medical recovery, physical healing from surgery, was significantly different in those three groups. And both groups of kids who were able to either see the trees for real or see the pictures of trees recovered significantly, statistically significantly faster than the kids who had no access whatsoever to any image of nature. So there is something hardwired in us biologically and physically that I don't understand. I'm sure there's work out there about it. That is, our nervous system settles when we are in nature, even if we're just looking at a picture of nature. And when I mentioned earlier the fight or flight response and the rest and digest are two sides of the same neuro response. So it's one of our, we talk a lot about it in clinical treatment for people with trauma and anxiety. All you have to do is, well, take a deep breath. That helps. Go outside. Take a walk, 2 minutes. Look at a tree, look at a plant. It short circuits your stress response and starts a healing process in a very deeply profound way.
Green spaces in cities and in towns, oftentimes are, cited for their value of environmental value or, aesthetic. But it sounds like if this research were to be front and center to that, also in the community itself.
Yes. And I think, if we were to put the recipe together of all of the factors, excuse me, all of the factors that really are the perfect recipe for helping communities heal, it's engaging multi-generationally in activities that are in nature, are collaborative and creative. I think there's another piece of trauma, and what that does to us is it takes away our agency. That a hallmark of an experience that is potentially traumatizing is I didn't have any control over that. Somebody victimized me, I was exposed to something, I couldn't control that. And the loss of agency over our own well-being is a factor that we can heal from by giving people opportunity to have agency and creativity over our experience. So, parent-child gardening activities in the city so that they can be in nature, they can be working together, the phones are gone, they're constructing together, they're creating together, and they're seeing that what they do creates life are all factors that at a very deep biopsychosocial level facilitate healing from trauma.
So it sounds like empowerment, of empowering the individual to help regain the agency, as you say.
Correct. Yep.
Well, I think maybe to start closing up, looking at the present state of of where we live, do you see that are we moving towards what the research says to do, or are we still learning? How are we embracing this as a community? Some of these things that we are seeing to be true about healing from these events.
It's a tough question. I think I want to say yes and no, and it depends. I think there are some places where we are moving in the right direction. I guess one thing that I didn't mention earlier in the soup of what, or the puzzle, if you will, that excuse me, either exacerbates trauma or helps heal. is somebody's experience, having a hard time figuring out how to say this, so but I'll come back to that in a couple minutes when I have a better idea about how to say it. So I think how we as a community, we're moving in the right direction. I remember what I was going to say, is about validating somebody's experience. And I think that's really important to say, which is how each person experiences a potentially traumatizing event is their own experience. And in the old days when we would say, oh, get over it, right? That's not helpful to somebody finding their way out of it, because your experiences, your protective factors, your brain chemistry, your resilience will determine whether we experience the same situation, whether you have lasting traumatic response to that versus whether I do. So something we're starting to do really well as a society, I think, is recognizing that my experience should not determine your experience. And that if you are struggling with a particular situation, get support for that. That's okay. That's valid. That's your experience. So, for example, we work a lot with the Department of Public Health in Massachusetts to create and deliver programs for people who've experienced trauma. In Greenfield, our recovery programs over on Federal Street do a lot of that with people who have experienced and experiencing addiction. And one of the things that Department of Public Health is putting in their program requirements now is that providers assess and work actively on creating trauma-informed environments. And you see that in treatment spaces. We do a lot of consultation with public schools on creating trauma-informed and trauma-sensitive learning environments so that kids, when they come into school, aren't getting the pull yourself up by your bootstraps and just deal with it, right? They're getting what do you need in order to be your best? How can we help you calm down in this situation so that you can engage in the learning? So I think as a culture in Massachusetts, we're doing a lot to recognize that we need to be intentional about these things. I think the work that we're doing on creating green spaces, supporting community activities and events with libraries and community activities, I think those things are moving in the right direction. I'd love to see more regulation around devices, particularly for children, at a advocacy level, at legislative level. I think the media, there was a video I watched once that was fascinating about the people who designed social media intentionally designed it to suck us in, particularly for young people, that they use the hooks that they use and the way they modulate their specific technology, I'm not thinking of the word right now, the rubrics for it, the algorithms, that's the word, the algorithms for social media are designed specifically to create addiction and prevent us from putting it down. So we need, I believe that we need regulation and education to help us remember that that's a tool, that's a choice. That's not our best self. That's not going to facilitate us being our best selves.
Well, Kathy, I want to thank you so much for taking the time to speak with me today, and I wish you the best.
Thank you. Thanks for including me.